name is Tess Wiskel. I'm a second-year student at Pritzker Medical School, and for this past summer I went abroad to Ibadan in Nigeria, and I was working on a project investigating the effects of indoor air pollution on the health of mothers and children. I worked with Dr. Shola Olopade on this project. He's a doctor here that works with the Global Health Initiative and on asthma and other sort of respiratory diseases. I was interested in going abroad because I thought this was a good time to be able to take advantage of the opportunities abroad, and I thought it would be able to give me a good perspective on other healthcare systems. I went abroad with funding from the Summer Research Project with Pritzker School of Medicine. This project was really helpful in that it allows the Pritzker medical students to have funded summer research. I also went with the support of the Global Health Initiative, which was really great in helping arrange for all of the logistics of the program and in helping us prepare before going abroad. I also had the help of Dr. Olopade and his team in Nigeria, as what my work was part of an ongoing project that he had a team in place in the field to be able to implement it. I had always been interested in global health. I had grown up traveling around a lot, and before coming to Pritzker, I spent some time traveling and volunteering in Uganda and traveling around East Africa. So I had an interest already in Africa and the healthcare systems there, and I was hoping to go and see a different part, and in this case West Africa, Nigeria specifically. So my project was looking at indoor air pollution. Indoor air pollution is caused by the burning of biomass fuels. This is a big problem in developing countries as they don't necessarily have access to electricity or cleaner burning fuels. So people will use other fuels such as firewood and animal dung for their fuel needs. And this in turn results in high levels of indoor air pollutants such as particulate matter and carbon monoxide that can have detrimental effects on people's health. So I went out to the field to a village called Erua, and every day I would go out with a team and we would do different things. We went and we monitored the particulate matter and carbon monoxide level when women were cooking in their homes. So we would physically go into their homes and measure these levels. We also looked into the respiratory health of the women, so we did spirometry and fractional exhaled nitric oxide testing of both the mothers and children. And we also did a survey, so we'd go into the houses and talk to the families about their health and about their homes and other sorts of demographical information. So we were able to show just how high the particulate matter and carbon monoxide levels were in homes, which were vastly higher than the World Health Organization recommendations. And we could also show that there was a detrimental health effects on this, specifically in respiratory systems and in impaired lung function, which we found through the spirometry and fractional exhaled nitric oxide testing. We're also looking at if there's a correlation between the levels of this particulate matter and carbon monoxide with the lung function. So this was my first time to Nigeria, and I wasn't really sure what to expect beforehand. We went to the southwest of Nigeria, so it was mainly Yoruba area, and I was just surprised by how welcoming everyone was, both into their culture and just being able to try different things, like trying all the different food and meeting new people and having them take us to church and take us around exploring Ibadan. That was really great. The big issue for me was the language barrier that made it very hard to communicate especially when I was out in the rural villages. A lot of people spoke English, but the less educated people spoke less English. So I always worked through a translator, and it's just frustrating sometimes to not be able to just communicate directly with somebody, but it was still great to see how much nonverbal communication and other ways to communicate with people that this brought out. So this experience was really great in that I was able to use clinical skills as well as like analytical skills for analyzing the data. I went to the pulmonary function labs here at University of Chicago before going abroad and was able to learn more about spirometry and pulmonary function tests before going, and then implement that while I was in the field. And it uses different things that you've already learned in class just from physiology and about lung function. And I was also able to use some of my background in chemistry for the analysis of the kind of environmental pollutants. I think this experience was able to give me a different view of people's access to healthcare. Just going out into the villages, you could see how hard it was for people to, first of all, access a clinic, and second of all, pay for that access to care. It also gave me a great view of the culture and just how welcoming people were when I went to their houses and came to survey. And I think that was also made me more interested in doing more global health work in the future. I think students should really explore their interests to find what experience really fits them, both in where they want to go and in the project they want to work on. I think you should also push yourself to overcome any sorts of apprehensions you might have about doing it, because in the end, if you really just try everything and go in with a good attitude, you'll be able to have a really great outcome. I think one of the main messages that this experience gave me was just how receptive people were to going and doing community research, and the need to continue this, in that it's difficult to start these sorts of clinical research programs in rural communities, but that it is really appreciated and the outcomes you can find are really important to the field of research. At the end of this project, I presented my work at the Pritzker Summer Research Project Forum, and I won an award for one of the best clinical research projects. In addition to that presentation, I'm going to go to the Global Health Conference in Montreal this November, and I'm going to do an oral presentation of the work there. Additionally, I'm working with Dr. Lapade and his team to help write up the work that we have done. I think this experience helped show me how important having insurance and a system to help pay for care is for people. And even though the US system has many imperfections, there are still ways to access care if you can't pay for it. And there was a big lack of that in Nigeria that made it hard for people to get care. So I knew I was interested in global health work, and there's a lot of global health work going on at the University of Chicago. And I was specifically interested in going abroad for the summer and working with somebody that was working on a clinical research project, because that was something I had never done before. I'd only done basic science research in the past. So this experience was able to let me get a taste of both clinical research and doing that abroad. And I found Dr. Lapade on the Global Health Initiative's website and was able to get a brief summary of his projects, and they sounded very interesting and along the lines of what I wanted to do. And then I was able to meet with him, and that meeting went well, and with the summer research project, we have a mentor supporting us throughout the whole thing. I'd like to thank Dr. Lapade for taking me on to be part of his team, and Femi here, who's been really instrumental in helping me with everything. I'd also like to thank everybody in Nigeria who I worked with, both out in the field, with the Healthy Life Foundation, and at the University of Ibadan, University College Hospital.